I'm really excited to be here. It is so nice to be in a room full of people who are passionate about brain injury. And I'm going to use the big term, brain injury, because stroke falls into that under an acquired brain injury. A lot of people hear brain injury and automatically think traumatic brain injury, an external blow to the head. But acquired brain injuries, stroke, brain cancer, lack of oxygen, those all kind of go together. So my presentation is going to be a little different. Everyone else's was so amazing and more on the clinical side. I think I'm just going to talk to you a little bit from a survivor point of view, some things I've learned along my journey, some gaps I've found, some barriers, and what I've observed in clients with brain injury that I've worked with as well. I think we kind of covered this already, but so in 2012, started my journey with brain injury. Didn't think it was going to be that big of a deal, but by 2017, I was on a 72-hour hold for suicidal ideation. And after, I moved through that and educated myself, I looked back and I thought, what went so wrong? And one of the commonalities I kept seeing was I couldn't find professionals that got it, that understood me, that didn't just account everything to depression, anxiety. No one seemed to get it. No one can possibly prepare someone for the complete loss of self and the amount of grief that comes along with brain injury. So getting connected to a proper care team was humongous for me. I met somebody that was a certified brain injury specialist that was leading a support group, and that completely changed my outlook and helped me start to get on a road to finding somewhat of closure to accepting my new normal. That person, they did not have a brain injury, but having that certification made me feel like I was understood. They took the time to study that specific area, and I felt like I was talking to a friend that got it. I didn't need to constantly explain myself. So that was integral in my recovery. So we're going to talk a little bit today about the CBIS certification and how it benefits the brain injury community as well as benefiting you as professionals. And this applies to so many different professions. It could be used almost anywhere. So the Academy was established after a 1990 study and subacute and post-acute programs were surveyed. 75% of staff felt that specialized training was needed for the brain injury population. 84% indicated that specialized training was very needed for unlicensed staff, our direct care providers, ones that are doing the hard work day in and day out, dealing with those challenging behaviors that we can sometimes exhibit, and really needing the knowledge and the skills and the confidence to be able to interact with these patients along their recovery. 90% thought the training curriculum should include cognitive, psychological, and social consequences of brain injury, managing challenging behaviors, and techniques for working with families. Brain injury is an extremely isolating injury. Unlike strokes that often come with the visible disabilities, brain injury is often called the invisible injury. Because if you were to look at me, you probably wouldn't guess what I've been through and what my brain looks like. So it's very isolating. People assume that you're functioning at a quote-unquote normal level when things are quite awry in the brain. And having this certification makes patients feel comfortable to come to you as a mental health therapist, as an occupational therapist. They know that you've invested that time and that you get it. So in 1996, the Academy of Certified Brain Injury Specialists was established. There are a few different types of certifications. I'm just going to quickly go through them and then really open it up for questions. just kind of when I'm a pretty informal speaker, and you guys can see this and read and follow up later, so we'll take all that time. So their main one is the CBIS, Certified Brain Injury Specialist. That is great for teachers, OT, PT, speech, doctors, nurses, social workers. I heard a lot of talk about discharge planning, which I think is amazing. That's a very difficult process. When you're in the acute phase after your injury, we typically don't remember that. Then you're in the rehab phase, and you're so overloaded. There's so much attention. There's so much work. You're just so tired. Then you re-enter the community, and that's when the SHIT settles in. Who am I? Where am I? Why can't I do this? Will I ever be able to do this again? Who can help me? It's a long search to find providers that understand. I've been amazed by the number of people that I've spoken to, clients that are on a continual search for a primary care doctor that understands. And even neurology. Not all brain injuries will show on a scan. So when you don't see anything on an MRI or a CAT scan, neurology really can't help you any further. But working with OT, PT, speech, mental health therapists, neuropsychologists, psychiatrists to get that chemical balance right, those folks getting the certification is crucial. It helps patient participation in recovery so very much. When you can't trust your own brain, you become very distrustful of everyone around you. A lot of people feel like they're being gaslit by medical providers. I think brain injury survivors, we just have an inert distrust because we're not always quite sure what is happening and who to believe, and your family gets tired of putting up with you, and the doctor's tired of seeing you. So just knowing that somebody gets it and will validate that is huge, and you want to participate in your recovery and you want to get better. So anyway, sorry I deviated there. It's not hard to get the certification. Most employers, companies will pay for it, as well as the optional training. So if this is something you're interested in to add to your marketability and your investment in the brain injury community, please talk to your employer and see if they'd be willing to pay the cost. The CBIS cost is $325. It includes the exam, and there is a discounted rate. I think it's like $250 for a group of 4 or more. But you need a high school diploma, 500 paid hours of direct experience. They won't count volunteer hours. It's a 70-question exam. The reason I think the training is crucial is we're all very busy. We're doing this in between taking care of our families and working, and the training teaches to the test. As much as the teacher in me doesn't like that, it's super helpful. It's a thick college textbook that covers A to Z of everything brain injury. So that's a pretty big amount of material to try to figure out what 70 questions they're going to ask you. So the training is geared to help you pass that test. It demonstrates your commitment to learning. You know, it's not just letters after your name, but it does increase your marketability when people are searching for a provider. And brain injury is an epidemic. It is higher than cancer, and it's increasing rapidly. So CBIST, Certified Brain Injury Specialist Trainer, that was the second step I took because I do like to teach. I'm not the best speaker at a conference, but I do enjoy teaching. You have to have a college degree for this one, 5 years experience in brain injury, and you don't have to test again for this. It's very easy to go from the CBIS to the CBIST. So once you get that first one, it's really easy to move through the system. And you get paid. You will find they enter your name in a statewide system, so you may get a call from New York for somebody that wants you to host a presentation. It'll fly you there, and you get paid. You set your own amount sometimes, so that's a nice little perk as well. Provisional certified. This is great for college students. It's easy for them to then move through the exam. It's at a discounted cost. They just have to do it within 3 years. So this is really good to put out to any students that you might be working with that are interested in getting this added onto their credentials. This one I think is amazing, and I think everybody should get it. The Brain Injury Fundamentals Program. This is for non-licensed staff at facilities, group homes, hospitals, nursing homes, and it's also for families. So it really helps those caregivers, the siblings, children, all those affected. It helps them understand, why is she laughing at something so inappropriate? Or why is she just crying all the time for no apparent reason? So it delves into kind of a dimmed down version of the big CBIS, all the brain stuff, but it really does help. I think education is power. So when we understand what is causing a certain behavior, I feel like we can respond to it with a little more grace. So I love this one for our direct care staff and families. And this one is a required course and exam. It can be done self-paced or it can be done through a trainer. There are multiple pathways to getting the certification. You can go out on the website and plug away, pay for it, take the test, order the study materials, or you could take it through a training session. The Brain Injury Alliance of Montana, we were going to host a training session, I think last month, but we decided to wait until after this conference in case anybody was interested. So we're planning to have one, a hybrid version. We're going to do in person, and then anybody that would like to join virtually. We're going to shoot for, I think, September, October here in Helena. Yeah, Helena or Butte? Helena or Butte. So that will be upcoming. Everyone should have a booklet on their table with the Brain Injury Alliance of Montana information. If not, there are some out on the vendor table. There's websites on there. We don't have this posted yet as it's not scheduled, but keep an eye on that, and that you can register through there if you are interested. And like I said, one of the big benefits is that I teach it to the exam. You'll have the materials to read at your leisure, but you're going to know exactly what you're going to be tested on, so that way you don't have to read this massive textbook for 70 questions. So there is benefit to it. And you get one-on-one coaching and, can interact with the cohort of your peers. I just talked about that. This is great for attorneys, voc rehab counselors, social workers, victims advocates. So if you know anybody that's interested, it's not just for the medical world. We're trying to get more people certified because this is an epidemic. Our prisons are full of individuals with brain injury. If somebody would have this certification and can identify maybe a elementary school student, middle school student, if they could be identified earlier and get that early intervention, maybe we could keep some of these people that are misdiagnosed out of prison, out of psych wards. A lot of times brain injury is not diagnosed until somebody has been given 10 different psychological diagnoses that all just really may be rooted in brain injury. So promoting this is very important to me, just to keep getting people educated and aware of what's out there, and what you can bring to your businesses as well. So that's it. I told you it was going to be really quick. That's the short of it, really. The information can be found at on the back of the pamphlet. Are there any questions for me? I'm happy to answer anything. I'm pretty open book. Yes, ma'am.
Fundamentals program, is that all online or is there a class to go to?
It is, you have an option of both. There is an online course, and the exam is online as well. All the exams are online. They're proctored through an online system. But the fundamentals course, there are two different ones. There's one, I think, like a virtual training, and then there's a self-paced one where you can just kind of go through on your own before you take the exam. Mm-hmm.
What? Yeah, go yeah, John.
Thank you.
Thank you, Amy.
I'm still trying to figure out how Joni recognized a commercial from 1988. My name is John. I'm with the Brain Injury Alliance in Montana. And thank you, Amy. Amy was nervous about that. So thank you, Amy. And thank you for opening up and sharing. So a couple different things. One is that in addition to everything that Amy said, thankfully to a grant that we received from the American Stroke Association and the Mission Lifeline Project, we do have funding set aside that will help pay for testing fees. So if you're out there and maybe you're on a tight budget or whatever the circumstances are, we'd love to invite you to be a part of that class, whether you're in person or self-study or online, and we can kind of help cover that testing fee for that.
What topics are covered in the CBIS?
Oh my goodness, there's a lot. It is.
Everything from microphone for the Zoom folks. Yeah, if you just want to go back up there.
Everything from statistics, mild, moderate, severe brain injury, to how to insert a catheter. So it is a huge amount of information that's covered. It's called the Brain Injury Essentials Guide, and they make you pay for that separately, which if you do the training, you don't need to buy it because I'll have the materials that I'll give to you. But it covers so much: statistics, causes of brain injury, a lot about rehab. So for those in the post-acute care, very informative. It goes over the different body systems, talks a lot about the endocrine system and that chemical dump that causes so many different problems. Nervous system, of course, and different parts of the brain. I think there's probably like 20 chapters. It's a large volume of information. Yes.
I'm just curious about the word epidemic and how do you associate that and where has it become an epidemic? Is it new? I mean, how long of a trajectory has it been?
I can't give you a starting year on that, but brain injury is happening at an exponential rate and it's continuing to grow. Diagnostic tools are changing. There's a service called 211 in Washington, and they help people get connected to housing and things like that. So now when you call, they do a brain injury screening. Have you ever hit your head? Have you ever lost consciousness? So I think they're gathering evidence from multiple areas, and they're seeing that there's quite an increase.
That 500 hours that you need to have, is that over a certain amount of time, or can it be 500 hours ever in your career? And then how do you verify that?
500 hours ever in your career, and there is a verification form that that you'll submit. And it's really, I've never had anybody say they questioned this. It's kind of an on your honor. You might need your current supervisor to sign off on it. I can't really remember that part, but I believe you just filled it out and said, yes, I have this, and you sign it and you turn it in. And I think you might have to submit transcripts, but that's something that we were talking about if we were gonna maybe take on, depending on how many people sign up, we might take on that admin part for the testers, so we'll put more information out about that. But again, I just think, oh, yes.
Sorry. Do you have a sense yet for that in-person training in the fall? Is it like 1 day, 2 days?
So I think we were going to look at 2 days, maybe 2 8-hour days, because it is a lot of material to go through. So 2 8 hours is what we were going to schedule in April.
And for that class, is it offered virtually to people who don't live in Montana?
Absolutely, yes. We're going to do a hybrid, and they can still register through the Brain Injury Alliance of Montana. And it never expires. You have to pay a small fee annually, but you don't have to test again. And I just think it's great because brain injury, the residuals are chronic. They're lifelong. So you just get to be a part of that funky little world that we live in and continue to help us. And I know if it wasn't for some of those people that were in my life, I would not be standing here today. So I thank all of you for your passion in being here and helping me be here today.